1.3 million Illinoisans have diabetes and require insulin to go about their daily lives. Those 1.3 million people have watched the price of insulin in the United States surge, nearly tripling in the first decade of the 21st century. This new law will cap insulin costs at $100 per 30-day supply, significantly below the $500 to $900 payments that many Illinoisans currently face every month. Diabetes affects people from all walks of life. It doesn't discriminate between those who can afford medication at unconscionable cost and those who cannot. But that hasn't stopped middlemen from sending prices skyward, forcing many insulin users to find their medication by substituting lower quality products or seeking options outside this country or even rationing their supply. And some have died doing so. That's why this new law doesn't just make insulin more affordable. It also enables us to figure out how we got here in the first place. Starting today, the Department of Insurance of Illinois will be examining the insulin pricing practices that got us to this point, and will deliver policy recommendations to the General Assembly about how to control and prevent overpricing of prescription insulin in the future. We've made a lot of progress in Illinois to improve health care in just the last year, and I want to recount a few of those things quickly. We expanded health care coverage to 120,000 uninsured Illinoisans. We've brought to Illinois hundreds of millions of dollars in federal health care dollars. We added compassionate care coverage for patients in our medical cannabis program. We required insurance plans to cover EpiPens for all 18 and under residents who need them, as well as treatments for hundreds of Illinoisans who suffer from Lyme disease each year. And I launched a multi-agency internal working group looking at ways our state can address the skyrocketing costs of healthcare. As we work to address the high cost of prescription drugs that are burdening millions all across our state, this new law is an essential step in fulfilling our promise to put state government back on the side of working families. And now it's my great pleasure to introduce a true champion who works very hard on behalf of working people all across our state, and my friend, Senator Andy Manar.
Good morning. Good to see everybody this morning. Governor, thank you for what you have done for the state in the last year. I want to start here. Over the last year, we've had so many bipartisan successes in the legislature. We passed a bipartisan balanced budget. We did any number of things throughout the course of our 5-month session that brought Republicans and Democrats together, and this would be the latest example. This bill was supported by broad numbers of both the majority party and the Republican Party in the legislature because we came together knowing how important it was for so many individuals, hundreds of thousands of individuals in Illinois, a few of which have gathered here today to talk about what this bill needs. I would tell you all that last spring, the governor and I sat down and I came to him with my legislative agenda. It was a hefty list of ideas, and this was on it. And the governor focused his attention on this issue, and he said, I want to get that bill passed. So we filed the bill at the end of May. Fast forward to veto session, and in record time, I would tell you, in record time, in about 5 days, session days in the Senate, we got this bill passed. And that's because of more than anything else, given the challenges with this, because of the governor's leadership. So Governor, thank you for helping us with the legislative push in the General Assembly.
Today I'm here to say thank you, not just for me, but for every single person who has been through what I've been through. I've had to ration my insulin due to the fact that I could not afford my 30-day supply that cost $1,800. I've been in and out of the hospital, close to being in a diabetic coma, more than once due to not taking my medication like I should, not because I wanted to, but because I had no choice but to ration the insulin I did have. I am so happy that I was able to be a part of this bill. There are so many people out there, friends, family members, even a stranger you see in passing, struggling with their health because they cannot afford their insulin. Parents deciding whether to pay a house payment or to buy their child's insulin. A single mom deciding not to buy her insulin so she is able to take care of her family. A teenager looking at her future, deciding her career based on if she will have insurance to pay for her insulin, not deciding her career by passion or what she dreams to be. By passing this bill, so many people will be able to not only afford their insulin, but stay healthy and stay out of the hospital. Going into debt because of a health condition you cannot get rid of or that you did not choose to have is a very scary and lifelong battle. I was diagnosed almost 11 years ago, and I'm still paying and struggling to pay off my debt that accumulated due to rationing my insulin and being in and out of the hospital. So again, thank you all. Thank you to all the supporters that have gotten us this far. This is just a stepping stone, and I cannot wait to see what more can be done to help other people with the price of their medication. And always remember, just because you are one person, your voice can still be heard. I know this now because I'm standing right here in front of you. So thank you for hearing my voice, and I am so glad I could be a voice for all the other people struggling with affording their insulin and having to ration their insulin. So again, thank you for hearing my story.
Right now, Americans are paying the highest prescription drug prices in the world, often double what people in other countries pay for the same medicine millions of people depend on. As a nonprofit, nonpartisan organization that advocates for people 50 plus and their families, AARP has heard heartbreaking stories from Illinois residents struggling with the high cost of prescription drugs. This is why AARP launched a sustained campaign this year to cut drug prices for all Americans by advocating for a variety of legislative, executive, and regulatory actions at both the federal and state level. Senate Bill 667 is exactly the type of legislation needed to help fight for everyday Illinois residents who are being forced to decide whether to pay for insulin or other basic necessities. And we believe that this will be a stepping stone to getting further reforms that will lower the cost of prescription drugs for everyone.
After being diagnosed almost 4 years ago as a type 1 diabetic, I quickly learned that I did nothing to cause this disease. T1D is an autoimmune disease in which you cannot produce insulin. T1D cannot be prevented, and there is currently no cure for T1D. I am one of 1.3 million Americans living with type 1 diabetes. In order for me to live, I have to have insulin. Insulin is needed for just about everything I eat and drink. Thank you for supporting and signing Senate Bill 667. Senate Bill 667 is an exciting movement for those living for T1D and is a step in the right direction for more affordable insulin, even if you can't afford it. You cannot just stop taking it. Thanks to this bill, fewer Americans will have to make the choice to ration their insulin. No one should have to worry about paying for a necessary drug to live. Thank you.
This bill, now the law, is the biggest step that we can take under Illinois law. So self-insured programs are insurance programs offered by employers that are not covered. Those are federally regulated. Along the way, at our press conferences, not only did we advocate for this bill, but we've also advocated that Congress and the President work together to do the same thing on the federal level for plans that are federally regulated. But this is the largest step under state law that we can take.
And of course, those who are covered by Medicaid are receiving it already through the Medicaid program.
Address there and postpone the implementation?
Well, certainly let me just start by being clear with everybody that any kind of fraud in this regard is unacceptable. And that's why we need to make sure we have hearings. We need to make sure that the Secretary of State, who already has jumped on this and has done a lot to identify any of the people involved and the situations. But I will say that we're moving very quickly to make sure that this is a safe system, the system itself is secure, and that the glitch that was identified no longer exists. So that's, I think, the most important thing. As to delaying, I think that, as you know, extra care. I think you've seen that some of the forms that were filled out, people they didn't check the box or they checked it inaccurately. That's some of the result here of some of the findings. The continuing look at that and making sure that is done right at the agency level will allow us ultimately to move forward with AVR. But certainly right now, everybody's being extra careful.
The sales tax on services has worked in other states, and how much are you going to consider that here? Or is that a third rail?
Well, that's not something that I've proposed. I know that was part of a discussion around property taxes, as if there were going to be a swap between increased sales taxes or expanded sales taxes and property taxes. That's not something I'm looking at. The report, of course, from that committee is actually been circulated in draft form, and most of the ideas have been surfaced to me anyway already, as individual legislators like to jump the gun and claim credit before the actual report is put out. So I've heard from Republicans and Democrats, and there are some good ideas in there, and we'll be pursuing those in the spring session.
Governor,
As you know, one of the big components of outmigration has been students who have decided, after going to school here, growing up here, that there isn't enough college financial aid for them to stay and go to school here in Illinois. We've seen a decreasing number of those kids stay. An increasing number get recruited away because of greater financial aid in other states. So what did I do in my budget? In the budget year that we're in now, we increased the number of scholarships, the amount of the scholarships, by more than 10,000 additional students. And what do you know? Maybe not directly correlated, but you ought to take a look at, you talk about the outmigration, the net domestic migration, which is the number that people should pay attention to. And it's challenging for the state. It has been for many years. But actually, interestingly, it's by almost 10,000. It's lower. That net domestic migration is by 10,000 lower than it was in the last year of my predecessor. So that's heading in the right direction. It's not right yet. You know, we need in-migration, not out-migration. And again, I'm working on that. Changing the tax system, make it fair. Remember, it's middle-class families that are getting up and leaving, working-class families that are getting up and leaving. Changing the tax system makes that better, easier for them to stay. And in fact, the system that was proposed in the bill that was passed in the legislature would establish rates that are lower than many of the other states that have graduated income taxes. So we think that that'll also help bring people to the state. One last thing. You know, if the system that we're in place now was working so well, the flat tax that many people have advocated for keeping on the other side of the aisle, if that were working so well, why do we have all the net domestic migration?
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.